The broadcast is now starting. All attendees are in listen-only mode.
Well, we're going to go ahead and get started. Welcome, everyone. This is Dr. Lorne Lavine. Many of you know me as the digital dentist, and I wanted to welcome everyone to tonight's webinar. As of this morning, we had a little under 250 people that were registered, so it's obviously a very hot topic, and we're pleased to see so many people that are logging in right now. I'm only going to speak for a few minutes at first. I want to make sure that Rohit has time to speak as well. Many of you who have been on some of our past webinars know that when I do my webinars with Rohit, they tend to be a little more back and forth between the two of us, a little more conversational, which I think it makes it a little more interesting. And that's certainly our goal tonight is to make it a little more conversational and a little more interactive between the two of us rather than just talking to you. All of you should, on your screen, have a little GoToWebinar control panel. If you haven't been on the webinars before, you can go ahead and type in your questions as you think about them. I'm probably not going to get to most of the questions until we're done, unless we're in the middle of talking about something and I see a question that's relevant. I'll certainly do my best to get to it. But for the most part, we're not going to get to the questions until then. But please just type them in as you think of them, because we're certainly going to get to those questions at the end. When you log out, just indicate if you would like some follow-up from either one of us. We are recording this webinar as we do all webinars. So in case you can't stay towards the end, don't worry about it. You will be sent a link within the next few days that you can go ahead and download the entire webinar and view it at your convenience. Now, I was looking at the title tonight, and it says, you know, your top 10 questions on HIPAA. Ask the expert special. I think that's almost a little bit of a misnomer, the fact that it's experts. There's really only one expert on the call, and it ain't me. But I certainly do have my fair share of experience dealing with HIPAA issues. With my speaker this evening, I think the two of us, field a lot of HIPAA questions from our clients pretty much on a daily basis. We thought it would be kind of fun to sort of pick the 10 most frequent questions that we tend to see on a regular basis and deal with those questions. And as I said, I'm sure some of you have additional questions, which we'll do our best to answer as well. Now, for those of you who don't know me, as I said, my name is Lorne Lavine. A lot of people know me as the digital dentist. I practiced as a periodontist for 10 years. Over the last 12 years, I have been working with offices who need help with technology. In the last number of years, it's been computers and networking. We deal with disaster recovery and data backup, and certainly HIPAA services and especially some of the new Omnibus rules has made this an interesting topic for a lot of our clients. So I think this is really something that's important for people to know as well. As I mentioned, even though I do have a fair amount of experience dealing with HIPAA, and I lecture about it in most of my lectures, my partner in crime tonight certainly has considerably more experience than me and pretty much anyone I know. I think he's probably forgotten more than I know. But that's Rohit Joshi. And Rohit has held senior executive positions with life science and technology companies all across North America. He really focuses on using technology for effective communications. He's got a bachelor's degree in molecular biology, a master's degree in medical science, and a bachelor's degree in law. So, perfect person to have on this call tonight, someone who understands things from a legal standpoint, but also is somebody that is very much immersed in the medical and dental and healthcare field. So it's definitely a pleasure to have him here tonight as well. The questions that we're going to hit on, I'm going to show you these two screens, and then at that point I'm going to put it over to Rohit to get him to start talking as well. These are the 10 most common questions that he and I see on a regular basis. The question number one, what are the regulations that influence your dental practice? And most of you have heard of some of these terms, HIPAA and high-tech, and for people up in Canada it's PIPEDA. But what are these regulations? Question number two, and I get this a lot because people hear about some of the major breaches that are out there with some hospitals and Blue Cross Blue Shield, things like that, but we don't seem to hear it about with dentistry. And are dentists immune to this? Have there been any reported breaches in dental practices? We'll certainly talk on that as well. Third point are the new Omnibus rules. Many of you may have heard about these rules. They went into effect March 23rd of this year with a deadline of September 23rd of this year. So if you haven't really started worrying about it yet, you're already 3 months late. So no time like the present to get started with this. If you haven't done it, that's question 4, are there some fines, and how significant are those fines, and do you need to worry about that? We'll certainly talk about that. The 5th question that both of us tend to get a lot are, what are business associates? There's a lot of people that we deal with on a regular basis, our accountants, our practice management consultants, other offices, labs. Are these all considered business associates, and why do we need to be able to classify who's a business associate and who is not? The 6th question, what about this notice of privacy practice? Is this something we're supposed to give to our patients, or should we have it on our website? How do we distribute this notice to our patients? Number 7, if you're like a lot of people, certainly a lot of people that I work with, you haven't really done much yet. You've heard about it, you're familiar with some of these rules, but you really haven't taken the first step. And one of the things that we really want to help you with tonight is to give you kind of a game plan or a treatment plan of what can you do to get the ball rolling, to at least get started with this. In our experience, and I'm certainly Rhoda will back me up on this, it's virtually impossible for a dental office to get 100% HIPAA compliant. But you can get a lot closer than you are right now, and we'll certainly be touching on that as well. What about patient consent? Do we need their consent for certain things? We'll talk about that. What if a patient wants to communicate with us by email? Can they consent to that? Do we have to consent to that? What about if we're communicating with other offices? Can they have any control over how information is shared with other offices? The second and last one, we're talking about communicating with your patients. Again, how do we communicate with them? We have a lot of information that's going to be moving over the airwaves there or through the Ethernet, and how do we make sure that this stuff is HIPAA compliant, but also meets the privacy and security of that information. And then the final thing we want to talk about before we get to the questions is, what about email? I mean, there's so many of us that use email as our way of communicating with other practices. But the fact is that most of the systems out there, most of you that are using things like Outlook and Gmail and Yahoo Mail and all that stuff, probably aren't aware of the fact that you're using a system that doesn't come close to meeting HIPAA requirements, and we'll certainly touch on that as well. So with that, I'm going to turn the screen and the mic over to Rohit. And Rohit, it's a pleasure to have you back here tonight. And I'm going to have you start, move the slides, but I'll be chiming in throughout the presentation.
Thanks, Dr. Lavine. I look forward to talking tonight. As you mentioned at the start, it's a little bit of a switch for us. I think that this one we're really trying to include, really give kind of a year-end summary of all of the HIPAA discussions that we've had over the past 6 or 8 months together over webinars, but also, what you see in your daily practice and what I tend to see in my daily world as well. So I'm quite excited about this one. I'm looking, hoping that we can get quite a bit of interactivity. I think that what we both want here is lots of engagement. So please, for everyone who's listening, feel free to reach out and ask those questions, because we're really trying to drive this to what's going to be of interest to you. So let's start with the first question, which is, what regulations influence my dental practice? And as you mentioned, Dr. Lavine, this is a question that gets, frankly, a little more complicated every time I look at it. For starters, we know that there's HIPAA, high-tech, and in Canada, the HIPAA regulations. So I think that those are really the foundational elements of what's going to be forming the regulations for most every dental practice in North America. I will say, though, that there's significant, in addition to those three, there's provincial and state legislation, which tends to be unique to the province or the state. And while most of it's quite similar, I think that there are unique differences between them that we won't actually be getting into today. What's even more interesting is that within that even, there's different associations that the listeners are involved in, with their dental association and others, that may establish specific guidelines that also influence patient privacy. Really, from a practitioner's perspective, what are people going to be interested in? And so all of this information, all of these laws, the legislation and regulations all have to do with what is called protected health information. And that really is the protection of all individually identifiable health information. Now, you know, the breadth of that, I think there's about 17 different elements which would be considered individually identifiable health information. So the obvious ones here are patient names, patient addresses, patient's medical history. But it gets even more interesting when we start to think about images, which I know are a big part of the field of dentistry and something that we see every day transmitted through email. So if you can imagine, most of the emails that I see and most of the communications obviously have a patient name and a patient image. And those are both, you know, in the strictest way protected health information. So we're going to talk a little bit about that as we go through. Now, the regulations are pretty detailed, and you know, right now on the screen, what I've done is I'm just showing sort of the highest level HIPAA requirements, and not even going into many of the other pieces. What I'm going to do, though, is just sort of simplify it here, because I think that there's a few of these elements that are really foundational for everyone's understanding about what we may want to be looking at with respect to data privacy and data protection. The top one on the list that I would consider is one called encryption. Now, encryption is the application of a mathematical formula to the information that is sitting inside your computer or that's applied to any sort of electronic communication, which makes it very, very difficult to decipher by anybody who might get access to that information. So if someone gets access to that information, they can't read it. So encryption is really at the heart of a lot of the protection, because if we've correctly encrypted our data, anybody who does get access to it won't be able to read it. So that's a really important one. A couple of the other ones that we found come up quite a bit are in terms of logging and auditing. So there's auditing controls, and what that means is for every patient image, for every element of the protected health information, if you're sharing it as a dental office, if you're sharing it with a dental lab or you're sharing it with a specialist, you have to make sure that there's a complete log of all of that information. Who's touched it, who's viewed it, and who ultimately has control of it. Now, those systems can be reasonably complex, but they become another foundational element for HIPAA, because if patient data does go missing, the dental practices that are on the call right now, they have all gotten, hopefully, their consent from their patient to be able to use that patient information in the processing of the treatment. But if that patient data goes missing somehow, somewhere, the dental office is the one that took the consent to use that information and has to ultimately prove what happened to that information if some of it goes missing. So that's an important one. There of course is backup controls and individual identification, user IDs, and so on. But I'm going to leave most of those. So I think we'll end up touching on some of those in the remainder of the presentation.
Hey, Rohit, a couple of things that I wanted to just talk about.
Of course.
In the previous slide, you had talked about a covered entity, and I don't think we have to go into a whole lot of detail about what a covered entity is, but one of the misconceptions we see out there is the fact that a number of years ago when HIPAA first came out, some people felt that they did not qualify as a covered entity because they were not sending, for example, e-claims, or they were not transmitting electronic data. I would venture a guess that there's not a single person on this call that would not qualify as a covered entity. You're all covered. If you're a dental office, if you've got patient information, you're a covered entity. So there's no loophole there. The other misconception I see fairly frequently when it comes to encryption is that the HIPAA regulations call encryption an addressable concern, which means there's nothing in HIPAA that says you must encrypt, but basically what it says is that if you, and this is true for all addressable concerns, if it is reasonable to do something, then you must do it. And if it's not reasonable, then you have to come up with an alternative. And if there is no alternative, you document that there is no alternative. And I think there's a misconception out there with some practices that, oh, well, we don't consider this as reasonable to encrypt our data, so we don't have to do it. And that's not the case. Unfortunately, really get to make the decision on whether it's reasonable or not. It's the auditor that comes into your office, and considering the low cost to encrypt your communications with other offices, to encrypt the data on your server and your backups, I think it would be a very difficult argument to make that encrypting your data is not a reasonable procedure to be doing.
I couldn't agree more. I hear the same questions coming up. One is where dental offices don't feel like that they would necessarily fall within the HIPAA regulations. I'd say that in the past 6 months, I think since the visibility has gone up around the HIPAA and the Omnibus rules, I've heard less of that, but it still comes up. And I couldn't agree more that in terms of encryption, there's not really a price barrier for that, nor is there a technical barrier for that. So to call it something that isn't or that isn't an addressable concern, I just don't think you get any room with that argument. I think from my perspective, when I think of HIPAA compliance and I think of the various modifications that occur to it, there's a way of looking at it in terms of doctor-patient confidentiality, which I speak to a lot of practices about, and it helps make it more palatable because ultimately, I think all of the people involved in dentistry that I've met understand the value of doctor-patient confidentiality. What's happened, though, is that in the move to the electronic world, there's things that that the practice wouldn't have done in the real world that they might unwittingly be doing in the electronic world. And so understanding that the basis of all of this is really in doctor-patient confidentiality and protecting that communication seems to give people a way of thinking about it that's a little less punitive and maybe a little more beneficial in terms of actually affecting some change. So, as far as doctor-patient confidentiality, the duty of confidentiality prohibits disclosing the information. And in effect, what we can see HIPAA and the regulations that come in as really safeguards to ensure that only authorized access occurs, particularly in the electronic world, because that's where I think that there's quite a bit of violations, certainly in my review of the industry. One last thing just around the HIPAA compliance before I leave this slide. I have started to see now quite a bit of guidance that's coming from the associations. So it's, even though it's not necessarily that encryption needs to be included in some of that data, it might not be a part of HIPAA. I'm absolutely seeing it in state legislation, provincial legislation, and the guidance that's coming up from the associations. There seems to be quite a bit of information about that. But yeah, let's go on to the next big question. And this actually, Dr. Lavine, when we did some research about HIPAA breaches in dental practices, I think it was actually a question that came up in one of our previous webinars. And so we started to do some work in trying to categorize how many individuals have been affected or how many practices have been affected by HIPAA breaches.
Yeah,
and
I know it wasn't easy to find, Rohit, because I know if you go on, one thing that people may not be aware of is that when you have a breach, you have to report it to Health and Human Services, among other things, among all your patients and the local media, but you also have to report it to the Health and Human Services website. There's no easy way to filter through which ones are dental practices, but I'm glad you were able to do the research for that.
Yeah, it took a little bit of time, but we're happy to share it because we think it was it was actually, to be honest, much bigger than I had expected. So nearly 185,000 patients have already been affected. And we didn't, by the way, go into dental labs or dental insurance companies because there have been some large breaches there. These are 29 dental practices like the people on the phone. Now, it's just as interesting as how the type of breach occurred. So the most interesting one, if we look right to the bottom, is theft. And people are going to wonder, well, how does theft, what's the connection between a theft and a breach? Well, the fact is that you, in your dental practice, are responsible for that patient information. So if someone comes in and steals a laptop, or or you leave the laptop inside of your car and your car gets broken into, and on that laptop there was patient information, those things qualify as breaches because that information, in the cases that we've been able to research, that information was not encrypted, meaning that anybody that had physical access to that computer could actually dig into it, and if you have passwords, a couple of passwords isn't going to stop someone who really wants that data. They're able to get in there, they're able to see all of the patient IDs and all the patient information. So that theft was the largest one, was really interesting for us because, you know, the other question we get asked a lot of, Dr. Lavine, I'm sure you've heard this too, is no one's going to come after me. I'm a guy in nowhere, USA, and there is no HIPAA police that's going to knock on my door. Well, you know, at some level I'm saying, yeah, that's probably very true. You know, there's only so many people that are going to be chasing breaches. But what we don't, when you look at what's on the list here, all of those elements, none of them involve the HIPAA police knocking on someone's door. These are all things that happened to that practice that they did not control. So anyways, as a point of interest, I thought these are some interesting numbers. So improper disposal.
Another interesting, Rohit, I don't know if people knew this because I've been watching this on the news. It came out last week. There was a practice in Pennsylvania, maybe Harrisburg or Williamsburg, one of those places, but it was all over the news. It was a Dentrix 11 practice that somebody was downloading torrents from a torrent site, like I think it was from Pirate Bay, and they came upon a Dentrix database. It was from this practice in Pennsylvania, and 5,000 plus patient records in there. That you know, that's obviously a breach, and you know, how would the practice even know? But their data was up there for anyone that wanted to download it, and you could just imagine how devastating it was to them. And again, you know, these things absolutely do happen, and that practice had to send a letter to every patient of record notifying them of the breach. So you can imagine how devastating that would be.
Well, and that's something we should mention on this slide is for each of those dental practices, here's what happens. If you've been breached, if that data has been breached, you have to notify every one of your patients that's in your database that their data has been affected. And if you can't get a hold of 10 of those individuals, 10 of your patients, you now have to publish it in a newspaper that indicates, you know, practice such and such has had a data breach. Please contact us if you were affected between this date and this date, or if you were a patient between this date and this date. You can imagine how devastating that can be from a practice reputational standpoint. It's quite terrible. I know that we've had some experience with some dentists that have had breaches and who've then contacted us to actually try to help them and get more secure. And it is devastating because not only do you have to tell everybody what's happened in your practice, best practices mean that you actually have to do a credit check for those individuals because it's identity theft is possible. So it's not really like canceling a credit card. That's pretty easy to do, and frankly, the credit card will cover your loss. This is actually identity theft, so that the people who have that data can actually apply for credit cards in your patient's name, and then just change the address. So now they're getting credit cards that are in the patient's name that they can now use. That's the fear, and that's what HIPAA is meant to prevent through encryption and through other methods. So, you know, just before we move on from this slide, you know, there's some interesting stats. The largest number, as we said, the largest number of HIPAA violations are due to lost and stolen mobile devices like cell phones, laptops, USB memory sticks, and so on. Interesting stats, 113 cell phones are lost or stolen in the U.S. every minute. 56% of us misplace our cell phones each month. And 12,000 laptops are lost each week in U.S. airports. So not an isolated issue. All right. The next question is, what are the new HIPAA Omnibus rules? And as a way to kind of contextualize them, I think it's over 500 pages, these changes that were released in March of 2013 and then came into effect September 23rd, 2013. The way the Department of Human and Health Services calls them are the most sweeping changes to the privacy and security rules since they were first implemented. So quite a few changes. If it's something that, if you were HIPAA compliant, it's worth going through the changes so that you can update your documents and update your practices, because there have been enough changes here that that it requires that kind of an update. So we're going to talk in reasonably quickly around some of these rule changes, just to give some guidance around where they occurred. Copies of electronic protected health information. So doctors only have 30 days to respond now to a patient's written request for his or her own protected health information. And, reality is that you can provide those electronically, and only when the individual rejects e-formats do you actually have to print those out.
You can't charge a fortune for it either.
Yeah, that was one of the other things, is now you can't, there are real restrictions on what you're going to be able to charge now for people who request their protected health information. Emailing, there's quite a bit of information that's been written, and this is some of the guidance that's come out around the Omnibus rules. While it is possible to send protected health information, the individual who's receiving that information needs to be advised of the risk of what they're agreeing to receive. So if a patient comes to you and says, just email me, it's not as easy as just emailing them. There's actually steps that you need to make sure that they've understood what that means.
I know you're going to get into this in more detail, Rohit, but I think we also need to stress that that second point there refers only to communications between doctors and patients. It does not apply to others, which we'll get into a little more detail.
No, you're absolutely right. So that's an important point. Is it does not address the doctor to lab, doctor to specialist, doctor to doctor transmission of information. You cannot consent out of that. Breach notifications, I've actually got some details about this a little bit later, so I won't spend too much time on this. And marketing communications. So this is an interesting one because I think there's a number of questions of what marketing communications actually means, and it's really where the test that's being applied to what is a marketing communication is a case where one of the practices would encourage the recipient to use a product or a service where they'll receive payment. So that's how they've categorized marketing communications, and so interesting because there are now more rules than ever that you need to get consent and make sure that people know exactly what they're signing up for in a very specific way. And to be honest, I don't think I have the breath to go through all of these. There's a lot of details in terms of how about disclosure to different health plans. The sale of protected health information is strictly prohibited now, and it wasn't before. Childhood immunizations, charging for copies, and this is what we were talking about earlier, research authorizations, and there's some complicated rules around that. But those are the major sections, so I didn't want it to be incomplete without going through them. But again, I think this is probably less applicable to our audience today in terms of what's going to be the things that we want to spend time on. So the questions. The fourth one that I've heard quite a bit of is, what are the fines? After people understand that there have been breaches, of course the natural question is, well, what are the fines? And the new rules clarify with some degree of detail, that there are 4 penalty tiers. Now, what are the fines? They can start as low as $1,000, and in the case of the highest tiers, go up to $1.5 million per violation. So at the lowest tiers are cases where the doctors didn't know that there was a breach. An intermediate tier are cases where the doctors knew, or by really doing some thinking about it, they should have known that there was a violation. With the highest tiers, and unfortunately, with everyone starting to really understand what HIPAA is about, there's cases where doctors acted with willful neglect. And the 2 tiers come because they either corrected the problem once they were aware of it, or they didn't make a correction. And so, there's 4 tiers here, and there's quite a bit written about how those penalties are applied. How do you go from 1,000 to 1.5 million? But it's getting harder and harder to say that it doesn't apply to me, or that I don't have to consider it anymore. And so, these highest tiers now are starting to be applied. There's a really interesting case about that happened on the doctor side of it, not on the dentist side of it, where a group returned a photocopier. And that photocopier had on it, on its hard drive, years of patient data that had been photocopied but still remained on the hard drive. In that case, that practice was fined, or it wasn't a practice, that business was fined $1.5 million, because they should have known that that information is protected and it is in that fax machine, that copier machine. So anyways, some very interesting elements that it makes it harder and harder to say that we didn't know better. Now, the question of business associates, and I think Dr. Lavine, I'm sure you've been asked for business associate agreements in parts of the business that you are, that when you're working with practices. We certainly have, because a business associate is really a person or a company that works with your practice and somehow or another is in contact with that information. So good examples of that are, claims processors, or an IT services firm that's coming in and helping you with your Dentrix or with your practice management system, or is setting up your, your cone beam CT scan. All of those individuals do have access to that protected health information because they're working very closely with it. And as I mentioned before, companies like Brightsplit, because our company deals regularly with ensuring that we're keeping all of the patient information private. And so every one of those organizations that has access to that patient information needs to sign an updated business associates agreement.
Hey, Rohit.
Yes, sir.
I think one thing to add in there is that for the most part, any people that have access to the data but are involved in basically the continuum of care for that patient wouldn't necessarily be called a business associate. So, for example, if you work with a specialist, they are really not considered business associates. I think labs, for the most part, would not fall into the business associate realm, even though they certainly have access to the data. They are involved in patient care and would not meet the true definition of a business associate.
Yeah, that's a great clarification. And the way to kind of look at it, I kind of look at it, and I don't know if this is how you see it, but in the world of healthcare, you're either a covered entity or a business associate. All of that data has to comply to a strict regime of how it's going to be managed, how it's going to be transmitted, how it's going to be stored, and how it's going to be destroyed. Because it's meant to ensure that confidentiality occurs for that patient. Is that sort of, is that too simple, Dr. Lavine?
No, I think, as I said, it's basically anyone that's involved in the care. And I think the most common examples that we see would be labs and other offices, and certainly the ones who would be true business associates would be your IT company. We do certainly provide forms for all of our clients. Your practice management consultants, your accountants, those people who aren't involved in care, but certainly have access to that patient information. Those would certainly be traditional business associates.
Agreed. So now what the Omnibus rules have clarified is that the business associates themselves have direct liability for violations. They are now responsible for any subcontractors that they hire. That while doctors are liable to the actions of their BAs, BAs are responsible for their actions of their subcontractors. So do your homework with the people that you're bringing into your practice to help you with your IT work, to ensure that they've really done their homework and that you can really vouch for them as a business. And that's what that business associates agreement is meant to do. So anybody that's touching that data that isn't necessarily involved in the treatment needs to still live up to that standard because they do have access to that data. Now, there is a bit of grace around this because of the Omnibus rules coming into effect on September 23rd, 2013. The practices, anybody that's on the webinar, we do have until September 23rd, 2014 to bring all of those agreements into conformance with the new rules. Okay, next slide. All right. Oh, you know what? I think I might have missed one. Yeah, here we are. What's the notice of privacy practice? And so as part of the Omnibus rules, these notice of privacy practices has been updated. And basically, these are meant for your practice to be able to tell your patients about your practices. And there's a really good example and that's available at the Health and Human Services website. But in fact, I think what we will do for everybody that's on the webinar is if you just write in NPP into the chat window, we will send you a copy of this so you don't have to go searching for it. As a matter of fact, what I forgot to mention on the previous slide with the business associates was if you enter in BA into the chat window, we'll also send you a good example of what a business associates agreement will look like, or should look like, with all of the updates for the Omnibus rules. All right, so with this notice of privacy practice, you have to post copies and make sure that they're available at your office to any new patient and anyone else that's looking for it. If you have a website that does talk about your notice of privacy practices, you do want to update that on your website as well, so not to forget that. We've seen quite a bit of quite a number of sites that still haven't updated that, and it's a small thing, but it's just another thing that that you should probably do. All right, so the question that we get a lot of is where do I start in my dental practice? And since we've started doing these webinars about a year ago now, this has been probably the one thing that's garnered quite a bit of attention, and rightfully so. I think the list of things to do can be so long that it almost becomes difficult to know where to start. So here's a place to start. Have a meeting about HIPAA compliance in your dental practices. So it's most important just to start the conversation. Make sure that everyone that's working in your practice understands the requirements for patient privacy. Now, as it relates to making that as easy as possible, if you go to our website, www.brightsquid.com, and you search for the webinars, we actually have a full webinar which is entitled Your First 3 Steps to HIPAA Compliance. If you do nothing else in that meeting but play that, I think that's a great place to start because everybody will understand the importance of keeping patient information private, and that's really where we want to start. In addition to that, we've also got something called a HIPAA compliance software checklist, and that's for companies like BrightSquid and other companies that you're dealing with to make sure that they are in fact HIPAA compliant. So as much as you want to do that within your practice, you also need to make sure that all of your vendors are also compliant. Designate a project manager to manage HIPAA compliance, and then really determine the next step and set some goals. And we even have some assessment forms on our site, and we can direct you to some to show you where to go to start. Now, again, I would recommend that you go to our website and download the webinar. We've got it there. We did it with Dr. Lavine a number of months ago, and it was about the first 3 steps. It's the one I think would probably hit home the quickest. As far as the Omnibus guide goes, if you write in your chat window, just write Omnibus, we'll send you all these things. We've got a HIPAA compliance checklist for inside your practice. the software checklist to send to vendors. We'll send you links to all of our webinar series. We've even included the patient privacy brochure and a notice of privacy practices, and finally the business associate agreement. So this is kind of the full package, and it's something that we started to create a while ago now, and just to put it all in one place and make sure that your practice can start off on the right foot. So again, just write Omnibus in your chat window, and we will send that to you. Anything around this, Dr. Lavine? I mean, I'm sure you get asked this question about where do I start?
Yeah, no, first off, I think it's very generous that you're willing to give out those forms. The ones that we usually give our clients are the ones that you provide to your clients. They're so good, and I figured, why reinvent the wheel here? So we've been very happy to use them. And I agree, it really is challenging for a lot of practices. I understand, listen, I practiced for 10 years, and I understand what it's like. We had to deal with OSHA all those years ago, and now you've got HIPAA, and the problem with HIPAA, at least until the Omnibus rules came out, is that it's been pretty much a moving target. The ADA had a manual on HIPAA requirements that pretty much was outdated before the ink hit the paper. The whole goal of Omnibus is to finalize a number of those rules. Not that it necessarily makes it easier to actually follow them, but at least you now know what you're getting into. And as Rohit had mentioned, I think there's a lot of resources out there, whether it's reviewing the webinars. There are IT companies that can provide IT services like ours. There are companies that can provide encrypted email, which we'll talk about in a little bit. But there's a lot of resources out there for people, but don't try to do it all at once. It's overwhelming, and we understand that the deadline has passed, but you're going to drive yourself and your staff crazy if you try to do it all in 1 week.
Most important thing is just to get started. The worst breaches and fines that I've seen really come in the case where people just haven't paid attention and have almost, have taken a very bad backseat to HIPAA compliance, and that's where you can't be saved. It's time to start. I think that's sort of the message with all of this.
What website should they go to if they want to view the old webinars?
It's all on our website at www.brightsquid.com. We've got under the resources tab, there's all of our webinars are listed there, including full questions and answers. So you can see all the questions that were asked during the webinar, all of our answers there as well. So if you didn't get a chance to answer, if you're listening to a recorded version of this, for example, there's a good chance your question may have already been asked, and the answers are there.
Perfect. Okay, thanks.
So let's talk about patient consent, because this is, I would say that this forms the basis of a number of questions that I get. So the statement that I hear is, all I need is patient consent, and that's not entirely true. Now, the practice can get consent to send the patient their information over email. That is true. So the patient comes into your office and says, yes, I consent to getting my information over email. The important part of that is there's now an additional consent that's required if you want to market to that individual, but that's a different issue. Patients can give their doctors consent to do that. However, patients cannot consent to a dentist sending that information to any other medical professional through unsecure methods. So, in the case of a referral, for example, a patient can't come to you and say, hey, just send my information to that doctor, or send my information to my orthodontist or my implant surgeon. They cannot allow that to occur. That's really the doctor's responsibility. And that's where you have to take a stronger line than even your patient wants, because ultimately, although it is their data, you have a duty and responsibility to protect that information. And it's kind of a fine line, but I take a pretty hard line on this. If you do the search on the internet, you'll find ways that you might be able to do it. I think, frankly, that it's not worth it. You'd never want to take that risk, because you've taken that oath with that patient to protect it, to protect their information, and I think that's paramount. So the question then comes is how do I, how can I communicate with the patients? And there's lots of different ways, even with maintaining HIPAA compliance and including all the latest regulations. The first is you can call your patients, but you have to take precautions when leaving messages. You can't disclose sensitive treatment information because you don't really know who's listening to that message on the other side. So while it's okay to say, give us a call or remember that you've got an appointment tomorrow, you don't want to start getting into the use or of anything that is treatment specific, like the drugs they should or shouldn't take prior to the session or whatever else might be very specific. So you have to be careful. And there have been some HIPAA violations that have been reported around that. Appointment reminders, those are okay. But again, the appointment reminders that say, do or do not take this particular medication, you cannot disclose that part of the information. Sending faxes or receiving faxes. It's fine to use fax to communicate. Usually this is about the patient. So you can send faxes to your patient, but you have to make sure that your fax is located in a secure place and make sure that you've got authority and consent from the patient before you send them a fax. And with email, and we've kind of already talked about this, you must get consent from your patients before you use email to message them. About the privacy policies, again, this goes back to saying, you have to make sure that they understand what your policies are with respect to patient communication. And, there's a number of different places that's going to find its way, whether it be the patient privacy brochure, the notice of privacy practices, and providing patient records. That has to be clearly consented and detailed. I would, invite you to a webinar that we're doing on January 16th in the new year, which is really focused around this topic. It's made for probably many questions that we just don't have time to get to in this session, but we've titled it 4 HIPAA violations dentists make when communicating with their patients, and I think that's going to be a really interesting one. If you're already, because you've subscribed to this webinar, you'll be seeing that update when we're ready to send it out, all the detailed information. So now I'm going to focus a little bit on email, because again, I think this is the predominant method by which people send and receive information about patients, whether it be to the patient. In most cases that I see it, it's actually between covered entities, so between the doctor in the lab, the doctor and the specialist. So the fact is that even if your computer is secure, your message passes through dozens of unknown servers while it's getting to its destination. So even though my system could be quite secure, if I'm sending Dr. Lavine a message, it's bouncing around the internet, and a lot of those middleman servers are not compliant and not secure. So you have to take some precautions. It starts to get pretty complicated because, frankly, many of these systems that you use every day are not compliant. So if you look at your Apple Mail or something that your Outlook is connected to, it's really unlikely that it is compliant in HIPAA regulations. Gmail, not compliant. Google reads the emails, and really what I'm talking about is the free Gmail accounts here, which many people feel are fully compliant. They are not. Google reads your emails. Whenever I'm sending email from my Google account, I'll have all sorts of ads for dentists that I'm not interested in, but that Google thinks I'm interested in, because, as you can imagine, my Gmail is full of dental information. Yes, sir.
I think one of the reasons that maybe people are confused about Gmail is that Gmail announced in October that they are now willing to sign the business associate agreement, which I think some people meant to interpret that they are now HIPAA compliant, and I would say that's a step towards HIPAA compliance. And my understanding is only for their business accounts through the Google Apps. It's not for the free accounts. Either way, there's a lot more. There's a lot more that goes into an email being HIPAA compliant than there being a BA agreement. I mean, it's got to be encrypted, and obviously you can't have a service that's reading your emails. That would not qualify as compliant under any circumstances.
Yeah, agreed. And I think that we've heard a lot about that as well, and my read of it is that unless you're paying for your Google email, you're definitely not compliant. And even if you're paying for Google email, and I think it's $5 per person per month, at a minimum, some of them are, some packages I think are $10 per person per month. Even if you're paying, there's a lot of configuration that you have to do in order to make sure that you're even stepping towards that HIPAA compliance. So there's been quite a bit of media around that, but I'm still a little bit dubious. I think it's, I'm not convinced it's compliant as people would like. Hotmail isn't compliant, just like the Gmail. Dropbox and SkyDrive. Dropbox, I've seen people use that quite a bit for cone beam CT scans and other large files. It does not have HIPAA certifications. You can go to their website and you will see that. So, there's a quick slide, and this is an example of an email that I see regularly, where we've got in the subject line a person's name, we've attached a number of images, and we've actually got some case information as well. I see this, I have to say, every single day, and this is absolutely not HIPAA compliant. The service that I'm going to quickly demonstrate for everybody on the call here is something that we've called Secure Mail. And the idea is that we want to ensure that the system looks and feels as easy as normal email does, so there's no learning, it's very easy to use, but it is fully compliant with all the HIPAA regulations, so that we've got secure connections, we've got encryption, all the backups, everything's logged and fully auditable, so that if anybody's image goes missing or any email goes missing, the practice can contact us and we will tell them exactly who's read that information and who's had access to it. The other part of our product that I'm very proud of is that we've actually included 500 megabytes per message, so that I know that when I'm visiting labs, some of the cosmetic dentists that are very interested in the details will include very large patient images, and a number of them, 5, 10, 15 images. So we've put our limit at 500 megabytes so that all of those images can be attached to that email, and in one email that can be sent to the lab. And we really see that as a real plus. So I'm going to jump into now a quick demo of Secure Mail so that we can give just a quick example of what that looks like. All right, so you should be seeing my screen now. And what I'm going to do is it's a web-based product, and I'm going to log in here as a dentist who's checking their email, basically, checking the secure mail. So in this example, I've got a couple of emails from Dr. Pierre Fauchard, but I'm going to create one here. And here's some demo images that I happen to have up on my screen as well. Now, one of the interesting things about the way that we've done Secure Mail is that there's two components to the Secure Mail. One, the top part here is called an email message, which will go to the recipient's regular email address. That isn't difficult to understand. It's just like a normal email. What they're going to see, though, is a link for all of the information that I'm going to write in this area called the Secure Mail section. So I'm going to show you how easy that is. So let's say I'm going to send a message to Pierre Fauchard. In this example, I've actually got a picture of Pierre Fauchard there, really giving me kind of secondary visual confirmation that that information is going to who I want it to go to. I can write the person's name in this subject line because this is all protected by our software. In the email message, I can include this as a simple message, but I can also say something like, here is the information that here is the information that I spoke about today. So just a quick message to the person receiving it, Dr. Pierre Fauchard, so that he knows what that information was about. Now here I might say, here is John's information. And what I'm going to do now is take some of these images here and drop them into this particular area here. And I can take, as I said, many files here. And you can see that it uploads very quickly. And now this information, these images, even though they're protected health information, and I couldn't send them over regular email, I can send them in secure mail. And I could write as much information here as I want to, about John Smith. When I send the message, as you'd expect, it goes as any other email would go. And Pierre Fauchard now will get a notice in his normal email that says, I've received a message from Dr. Wilhelm. And just to show you what an email looks like when I receive it, here's the email message component. And here's a message that Pierre sent me which says, I'd like to refer John Smith for a possible implant. What I can do is I can actually view the image directly from the website here. So here's the detailed image. I can actually take and draw certain annotations to that image so that if I've got a question about it, I can say, so we've made it a little more interactive than normal email, really just to make sure that we can continue the conversation quicker. What we also have the ability to do, and I'll open up this message just to show you, is we actually have the ability to review some pretty complex things like 3D images. So in this example, I received a 3D image from Dr. Pierre Fauchard. This might come from an iTero system or from the lab from a 3Shape system. And once I receive that information, I can actually turn that information around and have a look at that pretty quickly. This takes just a few seconds. Many of you would be familiar with the 3Shape company for this. And it's not cooperating. I'll take any questions if you have them while we're just waiting for this to paint. It's a pretty big file.
Yeah, it's up on the screen now. I can see it.
Yeah, so what this 3Shape software allows me to do is take this image and rotate it, have a look at it. I can twist it around and spend some time with it really interactively. So if the lab is sending me this information, I have the ability to really look at it. But you know, in the interest of time, I'm going to kind of jump back out of it. Now, in this case, again, this is secure mail, and you know, my demos don't get much easier than that because, in fact, it looks and feels like your normal email would and should. So I'm just going to jump back into my slideshow now. One of the quick things that I just want to make sure everyone understands is it works with your current email address. Because we're using that email section of the message, that will go to your normal email or your recipient's normal email address. We're not going to give you a new secure mail address that you now have to monitor. It goes to your normal email that you continue to monitor on your phone, on your Gmail, or whatever else. But when you get to that part, you can see here that there's a link. And that link enables that security to occur. You know, we've been around for almost 2 years now in the market, another 2 years ahead of that, developing our software. We're proud to say we're in over 10 countries. We've got over 2,300 users and about 55,000 patients. Every week we see over 1,000 files go through our system. And you know, we're pretty excited to tell you that this time we're growing at about 10 to 20 new users a day. So it's getting very exciting for us, and I think that sort of is a testament to how easy the software is to use. If anybody on the call is interested in Bright Squid, certainly there's been a lot written about us, particularly as it relates to HIPAA compliance. We'd invite you to go to our website and chase down some of these items and really understand what we're about and how we're hoping to solve the problem. So for all of the users today and up until January 15th, what we've done, Dr. Lavine, is our normal pricing is $39.99 a month. And what that enables is 1 doctor and 5 staff to be on our product, so that, you know, it's basically $40 a month for that practice. And we've reduced that for everybody until January 15th to $29 or $30 a month, basically. We think it's super cost-effective, and again, really is something that everybody who's on the call should consider as a next step to getting HIPAA compliant. Very easy to do that right from our website. If you go to secure-mail.com or go to brightsquid.com, you'll see the sign up button. When you go into your subscription, you'll see the dentist subscription for $39.99. You can also buy yearly, and in that case, we will reduce the yearly cost by $75 a year. So you either choose monthly or the yearly package, enter the Lavine coupon code, and click Buy Now. And you'll be set up. We'll contact you within 24 hours of you signing up. We'll make sure that you've got your account set up and that everything is working for you. So that really ends the substantial part of the webinar, Dr. Lavine. We tried to do this in about an hour, and I think we did pretty well. But
yeah, when you say ends, it's not over for you because we got a bunch of questions here.
No. It ends really the formal part of the process, but certainly interested in the questions that might have come up during the session.
And I would certainly encourage people that if you have some questions that we didn't address or you'd like some more explanation on, now's the time to do it because we do have Rohit on for up to another half hour. So I'm going to get started here. How does email encryption affect your automated patient communication systems such as Demandforce and Lighthouse? Must patients participating in an email or text messaging sign a release acknowledging the risk with their PHI?
Yeah, so it's sort of two questions. I think that for certain, your patients need to be signing a release that, first of all, consents to the use of email to communicate with them. So whether that's email or SMS, you definitely need their consent. The second thing that we're seeing with the Omnibus rules is really this stipulation that they must understand the risks of using that medium. So your teams, whoever's speaking with the patient, needs to get very good at telling people what the risks are about communicating over email, just so that when they sign it or when they're writing it in the document, that it's not ignored by the patient. Now, how that applies to Demandforce and Smile Reminder and others, you know, the laws are quite clear in terms of the fact that you can use appointment confirmation software. So that's that stuff. That's fine. What I don't know, Dr. Lavine, and you might be able to help me here, is I know that some types of software actually enable the ability to enter treatment details. I would say that that's offside. If you're just reminding someone of a generic, you know, come for your appointment tomorrow at 10 o'clock, that stuff I think is absolutely fine. But if we're talking specifically about treatment details or prescriptions that they should or shouldn't take or things they should do before they get to the, I start to get uncomfortable because that to me is protected health information because it's talking about the treatment. Maybe you can tell me, is that kind of stuff, is that information flexible? Does it pull that type of information and provide that? Or is it just simply the appointment information?
Yeah, typically not.
Okay.
And I work mostly with Demandforce, so I'm more familiar with their system than Lighthouse and Smile Reminder and Yappy and ones like that. But all of them are as aware of the HIPAA rules and regulations as we are. And my understanding is that, you know, they do not send out information that would not pass the smell test. So.
Yeah, perfect.
Okay, we just got a bunch more questions here, so this is great. Some people are asking about the you know, whether they can get copies of the agreements, and you know, we got the list of everybody that's requested it, so we'll do that.
Sure.
Someone else was asking about whether slides are going to be available afterwards. I do record this entire webinar. You will all be sent a link that you can download it. It will be on BrightSquid's website. It's usually on my website, so you'll have plenty of places that you can download and view it at your convenience. Here's a good one here. Is it safe to put the patient's CD or USB drive in your computer? If the patient claims the data is from their other healthcare provider, perhaps they're seeing a second opinion from you or referred to you as a specialist. From a HIPAA standpoint, I'm not sure if there's any rules against that. As someone who provides IT services for dental practices, I always get a little wary about people sticking something foreign into a computer, whether it's a USB drive or a CD or whatever. I mean, the patient can tell you whatever they want, but you don't really know what's on there. And unfortunately, there's just a lot of malicious software out there. There's a lot of malicious people out there. With the ease of sending information electronically through email or through a web sharing site like BrightSquid, I would think that there are, we just don't see that much. I understand the nature of the question. I think people are using digital a lot more than CDs and thumb drives than they may have in the past.
Yeah, I would tend to agree with that. I mean, I would be very wary, and I'll tell you, it'll probably be someone who never knew that their USB stick was infected. But it starts to, well, it opens you up. You know, I would not want that for a practice, because you know, these things can slip by virus detection. It can slip by a lot of things, and I just wouldn't want that.
Yeah.
Much safer to send it through one of the sites. Yeah.
Yeah. So can you talk a little bit about the secure mail? Because so the recipient gets an email that, you know, has information, got a link in it. What prevents somebody just walking by to sign on and grab it? Do they need a username and a password in order to get into the site?
That's right. Yeah. So every person who is accessing our site, and this goes right back to our auditing and logging capability. So whenever there's information that's put inside that link, whoever's going to access that link is going to click on that link. It's going to open up a browser, you know, Explorer or Chrome or Firefox, and then they'll be challenged for their username and password. And so once they're challenged for that, now our system keeps track of whoever's been accessing it. And so every user on our system has a unique ID, and we just track it from there.
Okay. I think there's a follow-up question to that, though. So the secure mail, I mean, what makes it HIPAA compliant? Because obviously we've talked about encryption, but do you have the auditability and the logging and all those things that you had shown in that slide of all the things you're supposed to be doing?
That's a great question. We and we differentiate our service, you know, from a lot of other services out there because yes, in fact, we are we're not only our product makes any mail HIPAA compliant. If you just have encryption, or you still need to figure out how you're going to audit that. If you just have encryption, because there's lots of email encryption services out there, there's still all of the other segments of that HIPAA compliance that you have to make sure. So all of the disposal requirements, all of the auditing and logging requirements, even if you have encryption, you still need to ensure that you have all of those things. Our system takes care of all of that. So secure mail, if anyone's using it, we have, you know, disposal methodologies, we have retention policies, we have logging and auditing capabilities, and of course we have encryption.
Yeah. Is it really designed mostly for emailing patients, or is it you think it's more for dentists that are communicate with other healthcare providers, whether it's a physician, a dentist, lab, things like that?
Well, you know, it's that's a great question, and you know, you're going to be the first ones to hear that, you know, in the new year and soon into the new year, before February, we're actually going to create our system, secure mail, to be able to communicate not just with labs and other specialists, but actually with patients as well. So right now, the way the system sits, it's really meant for professional to professional. So the dentist to the lab, the dentist to the doctor to the other doctor. But coming in February, you will see us move into patient communication. So we're pretty excited about that change that's coming.
Great. Maybe you'll have more information for us when we do our webinar in January.
Absolutely. Yeah. We will have. Yeah, I'm looking forward to showing everyone that.
So you had mentioned about the need for consent from patients when, you know, you're doing some marketing things with them. What about, you know, things where there's no money involved, a blood drive or a food drive or something like that, where you just want to let them know that here's the stuff that your office is doing? Do you recommend that there be consents in place for things like that?
Yeah, there needs to be. There's sort of different levels of communication that have now been articulated, and so if it's strictly treatment information, they still need consent because you need to make sure you've got the correct email address. You know, I've come across many email addresses that are shared in the family. So you want to make sure that you have an email address on file that's unique to that individual. So that's the first step, to make sure you have consent. There is now this concept of marketing emails, and one definition of that is whether or not there's going to be product or service that makes money. There are fundraising types of emails that also get sent that you need to include in that large bucket, because anything that frankly isn't directly treatment related would be considered an extra email. And the Omnibus rules are pretty specific about that, making sure that has its own consent that's articulated.
Yeah, and I would certainly add, I mean, you know, typically when a new patient shows up at your practice, you're having them sign the HIPAA forms, you're having them sign informed consent. Why not put a consent for communications? It's relatively
Agreed.
easy to do, and it's done, and you got it on file, and now you don't have to worry about what you're sending out to them.
Precisely.
Got a few more questions here. So I think you addressed this as well. When people are using the secure mail system, they don't need to get a whole new email address, correct? It'll work right with their existing email.
Exactly. You know, one of the things when we designed our system is we didn't want to have people now have another email that they need to communicate out to all of their practices and all their labs. And so that's why we designed that two-part email. The top part keeps using your normal email, and it's in the top part of that email that we include the link to the bottom part of the email. And so it's that bottom part that's actually the secure part. The rest of the email communication goes just as they would normally get it on their phones or on their computers or however they're receiving the information.
Okay, good. So you had mentioned that the system can handle attachments up to 500 megabytes.
That's
How
right.
much does the monthly fee go up if someone starts uploading, you know, hundreds of gigabytes of data each month? I assume it's going to get a lot higher than that $30 a month.
You know, we've got something in our user agreements, but it's at the terabyte range, Dr. Lavine. One of the things that we, and I can't remember if it's 3 terabytes or something like that.
Wow,
but there's
a lot.
It's a lot. You know, I think what we wanted to do when we created our system is there's lots of ways of trying to limit access, and we really felt that we were much more comfortable as a company just saying, use it as much as you can, because we know that most people out there aren't there to abuse it. And use it as much as you can, flat monthly fee, and frankly, as you know, Dr. Lavine, the cost of storage space is going down every single day. And we take that on, we built it into our costs.
Yep. Another good question here, talking about business associates. Would you consider a bank to be a business associate, as sometimes they're processing patient checks?
Oh, that's very interesting. I don't think so. In fact, I think there is actually an exception made for financial institutions. They need to comply to something called PCI compliance, which in many cases is very similar to the HIPAA requirements around encryption and around information access. But the credit card companies and banks, they have that other set of regulations which protects financial information. But because there's no treatment information, I think it's a bit of a step away. And so I think that the legislation is quiet on banks and on credit card processors.
Yeah, and I would tend to agree with your assessment of that. And certainly we have a number of our clients who are very much concerned with PCI compliance. If you're taking credit card payments, you know, it's a whole new set of rules, similar in some ways to HIPAA, but in some ways your own set of things that you have to deal with, and you have to be audited on a regular basis, and it's usually not a whole lot of fun.
Yeah.
What about, so you talk about the monthly fee here. How long is the minimum contract for that?
You know, we try to show value every month that people are using it. So our contract is 1 month, and if people don't like the use of it, then there's no setup fee, and we're not tying people into a long contract. We have, like I said, we're growing 10 to 15 a day right now, and I'm sure that's going to go up every single day. So the system we have has been working, and we have no plans to change it.
Okay. There's a question here that I'm not 100% sure if I understand the question. I'll just read it as it's typed. How does HIPAA address PHI when audited by either local, state, or federal government?
Yeah, so the government is also exempt from some of the rules, if you can imagine. But I guess they're the ones that wrote it, right? They wrote the regulations.
Yeah.
So in fact, there's a specific exception for the times that the government is in there auditing you, that they have the right to do that. Their confidentiality, I suppose, has to be ensured. You might try to get them to sign a business associates agreement, but I believe that my reading of the HIPAA laws is that there's actually an exception for government audits.
Okay. So you talked about the fact that the monthly fee is for one dentist and up to 5 staff members. What about for specialists? Is it different for how you work with specialists as far as the number of referring offices that they can be with secure mail?
Yeah, so we've got a number of differences between the dentist package, or sorry, a secure mail package, and the specialist package. And what we've done for specialists is we've actually they would get into some of the other aspects of our product. So, or they could choose to use secure mail. But for those specialists that are interested in growing their referring base, we actually have a unique set of tools which allows you to do some treatment scheduling with your referring practice. And so they can log in, they almost get a dashboard of where all of their patients are at in their treatments with the specialist practice. So it's a really unique software, and we've got a number of specialists. It's one of our biggest and fastest growing areas, actually, because people are using it to really communicate outside of email, outside of secure mail, and really more on a dashboard type basis as far as communicating treatment scheduling. So it's a slightly different package.
Okay. What about if you're sending images to a lab or another office? Do you need to attach a special notice about privacy?
For certain you do, yeah. I think any information, so there's 2 ways of answering that, so I think I might know what they're getting at. You know, there's at the bottom of a lot of email that we read, there's always that, you know, if you're not the intended recipient, then delete that email. So that's one way of just saying, listen, this email is confidential. That hasn't held up in most jurisdictions because it's kind of like, you know, entering into a unilateral contract with someone. You know, if you said something like, you know, if you are not the intended recipient, I'll pay you $10 to delete that email. That might be more interesting. But there's no obligation on the recipient to actually delete it. Their goodwill maybe, but that's about it. So that's one way of answering that. I think that if I understood that question correctly, Dr. Lavine, maybe you can help me here. Was that sort of what they were asking, or are they asking really about the confidential? Oh, okay, yeah. So that's probably it then.
Okay. Here's one that I can answer. What about using Wi-Fi? Can this be intercepted by others when using an open network? The answer is yes. I'm not a huge fan of Wi-Fi. Now, the good news is that the devices that most of us use for wireless communications, the routers and things like that, do have encryption as an option. It's called something called WPA encryption or WPA2. There's an older one called WEP, which turned out to be not very secure. So they have those built into it. The problem is twofold. Number one is that encryption, for the most part, is turned off when you purchase it. So unless you actually know what you're doing, you have to turn it on and know that you have to enter in a password in order to be able, for other people to access it. So that's certainly one thing. The other thing that we have found, of course, is that Wi-Fi is already, a fraction of the speed that you're going to get with a wired connection. You add in the overhead for encryption, which is usually about 30 to 40% of the speed, and you've now got something that's probably going to be okay for your practice management data, but for images going around the office, it's going to be really slow. So we don't discourage offices from having, say, a separate guest zone for patients if they want, that's separate from your network. There's routers that can handle that pretty easily. Maybe if you want to walk around with a tablet or something to be able to access some data from time to time. But the real basis of your network should be a wired Ethernet. Certainly if it's encrypted, you're going to be, as close to HIPAA compliant as you can be, but it's going to be, unfortunately, slow as molasses, so it's not going to help you too much. What if somebody wants to know more about the secure mail? Is there a free trial, or can they get a demo, or what would be the next step?
Yeah, we can work with whatever people are interested in. There's certainly, we have our team members that are available for demos, and for sure we can get them a free trial as well. I would recommend that they contact us, and we can set up a full-featured 30-day trial, so they can get used to seeing if they can use it and they like it.
Okay. So to clarify, for example, sending CEREC scans to a lab, does this need to be encrypted, or should have a privacy notice attached?
Yeah, that's a great question. So I'm not as familiar with the CEREC scans, but if a scan is just a pure scan, a series of graphical elements, and there's no patient data attached to it, then it's probably okay. I can tell you, though, in these scans that I am familiar with, more the iTero system, you don't just have the scan data. You also have the patient information and quite a bit of detail around the prescription. In that example, you do need to encrypt that data, or you need to use a service that encrypts that data, because it is protected health information that you're transmitting. So I can't speak specifically about the CEREC scan because I'm not as familiar with that system. But I can tell you that for sure you're going to want that. Now, should you include a confidentiality thing at the bottom of your email? You probably should. But as I mentioned before, that's not really held up in terms of the effectiveness of that. What you're better off doing is getting a service or encrypting your email, which actually ensures that information is delivered securely.
Yeah, and I'll just follow up with what Rohit said there. There is this process called de-identification, which basically says that if you send an email or send patient information to someone else, but there's no identifying information, no name, no initials, no chart ID, social, none of that stuff, then you are probably within HIPAA rules and regulations. But you have to also look at it from a practical standpoint. If you're an office that gets, if you're a specialist office, for example, and you get referrals all the time from people, imagine having a dozen emails sitting there in your inbox that you don't know the patient's name. I mean, the process typically would be that you've got to call them up, or they call you and say, hey, by the way, I just sent you an email. It's for this patient, and here's the, here's information I'll give you over the phone. But, you're going to have multiple emails sitting there that you have no idea whose images those belong to. And I think it just becomes very, very complicated where, why not, just use an encrypted service, which is for sure HIPAA compliant, and you can track it, and you've got all these audit controls that Rohit talked about as well. So.
Yeah, I know that, what I have seen people thinking that they've de-identified the information is they've taken, a lot of the patient information out of it, but then included a photo so that the scan would have some relevance. And by including the photo, you've just, sent all that patient data back. So it's very difficult to de-identify that information effectively and still run a business.
Yep. Well, we're out of time and out of questions, Rohit, and I want to thank you very, very much. I've done about a half a dozen of these webinars with you over the last year or so, and they're always new. We're always getting a ton of great questions. That's one of the nice things, I guess, with HIPAA and the Omnibus is that it keeps changing the equation. So it's not like we can recycle these presentations. We have to come up with some new stuff to talk about each time, but that seems to be pretty easy. So I always learn something every time I hear you speak, and just wanted to thank you for joining us again.
My pleasure, and thanks to your viewers and listeners. We always appreciate the audience that comes out to these SMART group.
Yeah. I would certainly encourage people to take advantage of the special. A number of our clients have contacted Rohit to work with the secure mail. He says what he means, and he means what he says. It's inexpensive. It is so easy to learn how to use it. It's very price conscious, very price competitive, and it's just a great service. certainly when you're logging out, if you would indicate that if you want to get more information about secure mail or talk with Rohit, just indicate that when you log out. If you want to talk to me, Rohit certainly does a great service with secure mail. There's other things that you're going to need for HIPAA compliance, such as encrypting your data, which is really critical. Maybe some of you want to resync your backup and disaster recovery, which not only has to be encrypted, but it has to function properly. These are services that my company can certainly talk to you about, and just indicate whether you would like me to follow up with you. And I think we're done. As many of you know, we do these webinars on a regular basis. I am very happy to say, and my wife is as happy, that this is the last one of the year. We're taking a break for a few weeks, but we're going to be kicking it right up into high gear as soon as New Year's comes around. And we know how valuable your time is. I would certainly take advantage of the special that was offered. Rohit will be sent within the hour a list of everybody that indicated that they want those forms. And expect that, usually, we had a few hundred people registered here, so give it a few days for them to get it out to all of you. But I would imagine within a few days you'll all have received those forms. So we want to thank all of you for joining us, and we look forward to seeing you on future webinars. Good night, everyone.
Thanks, everyone. Bye-bye.